Hey there, amazing people. Welcome to Donut Dental. I'm Dr. Ganesh and I'm here to help you ace the CSCE OSCE exam. Let's get started. The oral cavity is a dynamic environment, susceptible to a range of conditions and diseases that can impact both oral and overall health. In this video, we'll continue our exploration of oral pathology, focusing on several key conditions that can affect the mouth. We'll delve into the causes, symptoms, and treatment options for various diseases. Bulimia nervosa and oral health. Bulimia nervosa, an eating disorder characterized by binge eating and purging, can significantly impact oral health. The frequent exposure to stomach acid during purging leads to perimyelitis, the erosion of tooth enamel. This erosion is most noticeable on the palatal surfaces of the maxillary anterior teeth due to the prolonged contact with acid retained by the tongue. The teeth may appear translucent or glass-like, and patients may experience increased sensitivity. Early childhood caries (ECC). Early childhood caries, also known as baby bottle tooth decay, is a prevalent issue affecting young children. It's primarily caused by prolonged exposure of teeth to sugary liquids like milk or juice, especially when given in a bottle before bedtime. The maxillary anterior teeth are most commonly affected due to their proximity to the source of the sugary liquid. ECC can lead to pain, infection, and even premature tooth loss, impacting a child's overall health and development. Fluorosis. Fluorosis is a cosmetic condition caused by excessive fluoride intake during tooth development. It results in white or brown spots, streaks, or even pitting on the enamel. While mild fluorosis is generally harmless, severe cases can lead to significant enamel defects and aesthetic concerns. It's important to monitor fluoride intake in children, especially from sources like fluoridated water and toothpaste, to prevent fluorosis. Gingivitis and Periodontitis. Gingivitis and periodontitis are inflammatory conditions affecting the gums and supporting structures of the teeth. Gingivitis, the milder form, is characterized by red, swollen, and bleeding gums. It's often caused by plaque buildup and poor oral hygiene. If left untreated, gingivitis can progress to periodontitis, where the infection spreads to the bone and periodontal ligament, leading to bone loss, tooth mobility, and even tooth loss. Infectious mononucleosis. Infectious mononucleosis, often called mono or the kissing disease, is a viral infection primarily caused by the Epstein-Barr virus (EBV). It's commonly spread through saliva and typically affects teenagers and young adults. The virus infects B lymphocytes, leading to a range of symptoms including fatigue, the hallmark of mono, often lasting for weeks or even months. Sore throat, a common symptom, often accompanied by swollen tonsils and difficulty swallowing. Fever, a low-grade fever, is typical, but it can sometimes be higher. Swollen lymph nodes, particularly in the neck and armpits. Headache and muscle aches, these can also occur, adding to the overall discomfort. In the oral cavity, infectious mononucleosis can manifest as palatal petechia, small red spots on the roof of the mouth. Enlarged tonsils, the tonsils may become significantly swollen, sometimes obstructing the airway. Sore throat and difficulty swallowing, these symptoms can make eating and drinking challenging. While most cases of mono resolve on their own within a few weeks, rest and supportive care are crucial for recovery. Over-the-counter pain relievers and throat lozenges can help manage symptoms. In some cases, corticosteroids may be prescribed to reduce inflammation and swelling, especially if the tonsils are significantly enlarged. Herpes labialis cold sores. Herpes labialis, commonly known as cold sores or fever blisters, is a recurrent viral infection caused by the herpes simplex virus type 1 HSV1. It results in the formation of painful, fluid-filled blisters on or around the lips. These blisters typically rupture, leaving behind ulcers that eventually crust over and heal within a week or two. The initial infection with HSV1 often occurs in childhood and may be asymptomatic or cause mild symptoms. Once infected, the virus remains dormant in the nerve tissues, periodically reactivating and causing outbreaks. Triggers for reactivation can include stress, sunlight exposure, hormonal changes, or a weakened immune system. While there is no cure for herpes, antiviral medications like acyclovir or valacyclovir can help manage outbreaks and reduce their duration and severity. Over-the-counter pain relievers and topical anesthetics can also provide relief from discomfort. Shingles, Herpes Zoster. Shingles, also known as Herpes Zoster, is a painful, blistering skin rash caused by the reactivation of the varicella zoster virus, the same virus that causes chickenpox. It typically affects one side of the body and can occur at any age, but it's more common in older adults or those with weakened immune systems. In the oral cavity, shingles can cause a range of symptoms, including severe pain, often described as burning or stabbing, affecting the affected side of the face. Blisters, fluid-filled blisters, can develop on the gums, tongue, palate, or inside the cheek. Numbness or tingling, these sensations may precede or accompany the rash. Facial paralysis, in rare cases, shingles can affect the facial nerve, leading to temporary paralysis of facial muscles. Prompt treatment with antiviral medications is crucial for managing shingles and reducing the risk of complications like postherpetic neuralgia, a persistent nerve pain that can last for months or even years. Pain management is also essential, and options may include over-the-counter pain relievers, topical anesthetics, or prescription medications. Oral cancer and irritation fibroma. Oral cancer is a serious and potentially life-threatening condition that can develop in any part of the mouth. It often presents as a persistent sore or lump that doesn't heal, and it can be accompanied by other symptoms like numbness, pain, or difficulty swallowing. Early detection and treatment are critical for improving outcomes and survival rates. Risk factors for oral cancer include tobacco use, alcohol consumption, excessive sun exposure, and human papillomavirus HPV infection. Irritation fibroma, in contrast, is a benign lesion caused by chronic irritation or trauma. It appears as a firm, painless lump, often on the buccal mucosa inner cheek. While it's not cancerous, it may require a removal if it causes discomfort or interferes with function. Candidiasis thrush. Candidiasis, also known as thrush, is a fungal infection caused by the overgrowth of Candida albicans, a type of yeast that normally resides in the mouth. It can occur in anyone but is more common in people with weakened immune systems, infants, and those taking certain medications like antibiotics or corticosteroids. Oral candidiasis presents as white, creamy patches on the tongue, inner cheeks, or palate. These patches can be wiped off, leaving a red area underneath. In some cases, candidiasis can cause a burning sensation or altered taste. Antifungal medications such as nystatin or fluconazole are used to treat candidiasis. Angular colitis. is an inflammatory condition affecting the corners of the mouth, causing redness, cracking, and discomfort. It's often associated with a fungal infection, particularly Candida albicans, but can also be caused by other factors like nutritional deficiencies, drooling, or ill-fitting dentures. Treatment typically involves addressing the underlying cause, such as using antifungal medications for fungal infections or improving denture fit. Conclusion. In this video, we've explored a range of oral conditions and diseases, from infectious diseases like mono, herpes, and shingles to benign lesions like irritation, fibroma, and fungal infections like candidiasis. We've also touched upon the serious issue of oral cancer and the importance of early detection. In our next video, we'll continue our journey through oral pathology, exploring other conditions that can affect the mouth and impact patients' quality of life.